Welcome. I'm here with Mr. Enrique Manrique. He is the program director for outpatient services for SCAN. Mr. Manrique, let me ask you, so then the person already came and was identified that he or she had a substance use disorder. So they come in again to see you. What happens next?
But one of the first things that we want to make sure is that the person feels comfortable. We want to make sure that they understand that we will respect the confidentiality and that we will not share any information without a written consent. So one of the first things that we do is we want to sit down with them and find out what their needs are. And we do this through what we call an assessment. The assessment asks questions regarding their substance use history, how it has impacted their life, their uh, uh, legal status, mental health, family. So these questions help us identify their needs. So sometimes a person will need some type of service, whether it's outpatient or residential.
Okay. So pretty much it's an opportunity for you to sit down and look at many areas of their lives.
Mhm.
Okay. So then what do you do once that you interview the person and you ask them all the questions about medical, legal, recreational, and all of that stuff? Once that you collect all this information, then what do you do?
Well, once we collect the information, we're able to look at what the needs are for the individual. This information the counselor gives to the person being interviewed, and from there they can make a choice of whether to take the recommendation, whether again it's going to outpatient
Mhm.
or residential setting. But it's really important to note that the individual makes the choice as far as their treatment
And
service.
that's what I'm understanding that you want to convey to people who reach out that they're always going to be in control, that it's always going to be their decision to make. So then, and you were saying also that there may be different services according to their needs. Can you talk a little bit about
Yeah,
that?
definitely. Based on their needs, sometimes persons just require a different type of setting. At times, it might be really difficult for them to abstain from drugs, so they sometimes need to go to a place where they can be safe and have an opportunity to reflect. And this is what we call residential placement. They're there for a period of time. It gives them time to reflect on what's going on. They'll go through individual and group counseling. Sometimes more a least restrictive setting would be more appropriate, and that's what we call outpatient, where they're still at home and they can come for appointments for individual and group sessions.
Okay. So then they will have different types of services according to how severe their needs are.
Yes.
Appreciate it. Thank you so much. I appreciate it.